Hello everyone. This video segment is on how to evaluate a DO applicant for your plastic surgery program. If you're reviewing this, you're probably a program director just like myself. And as we all know, the unification process under the ACGME concluded in 2020, where all training programs moving forward were previously known as allopathic or osteopathic came under one system within the ACGME. And as such, you are now, as a program director, probably seeing some applications from DO applicants coming across your desk. This is an informational video to discuss the parity of training and also medical education between our two disciplines. My name is Ben Lam, and I'm a DO plastic surgeon. So aside from being a program director, I was also the first DO member to sit on the RC during the unification process, so I feel very comfortable in bringing this information to you. I was originally asked by Dr. Arun Gosain to present this at the ACAPS meeting in 2023 in Chicago, and basically this is the video version of my PowerPoint presentation at that meeting. So at the end of this presentation, really in my mind, the $64,000 question is, how do PDs such as yourself objectively evaluate a plastic surgeon applicant if he or she happens to be a DO candidate? So to start, I'd like to do some comparisons between us, which are MDs and DOs, starting with the pre-medical school track, which is identical. So this typically is a 4-year undergraduate degree to culminate in a bachelor's degree. During those 4 years, the entrance exam to medical school, whether allopathic or osteopathic, is the MCATs. During medical school, which is also identical, this is 4 years in length, the first 2 being spent in basic sciences in classrooms, and last 2 are spent in clinical rotations. Upon finish of medical schools, there's a licensing exam, whether you're allopathic or osteopathic, which I'll go into in a second. And just to mention that DO license are unrestricted to practice in all 50 states, and we are found in every specialty of medicine. So alongside of this, there are some additional features that I like to point out along the way as DOs. So first, we are taught at a very early age to approach medicine in a very holistic manner, and that is that we treat patient as a whole and not just as a collection of symptoms or injuries. And this is part of our osteopathic philosophy, which is based on 4 tenets. Number 1, again, the human being is a dynamic unit of function, and that everything within us is interrelated. So I compare it to kind of the childhood song that the head bone is connected to the shoulder bone, etc., etc. Number 2, if the alignment of the body is correct or is maintained, and if necessary restored, then the body really possesses an inherent self-regulatory system that's able to heal itself. Number 3, structure is intimately related to function and vice versa. And then finally, number 4, based on the previous 3 tenets, then the correct treatment or rational treatment is picked accordingly. Because of this, DO medical students are mandated to take an additional somewhere between 300 to 500 extra hours of training. This is divided up into classroom didactics and also hands-on practical lab under a discipline which we call OMM. This is osteopathic manipulative medicine. Some people would loosely compare this to techniques that are used in chiropractic practices. So these techniques, majority of which are used in primary care, but these principles obviously are applicable in surgery, but we as surgeons will apply these surgically and not externally. All of which, upon graduation, culminates in a licensing exam. And currently there are 2 systems. So there is the COMLEX exam, which is the osteopathic version, versus the USMLE, as all of you know, which is the allopathic exam. In my opinion, these next 2 slides may be the most important of this presentation. So for licensing and ultimately residency application, we as DOs, what exam should we ultimately take, whether this is the USMLE or the COMLEX? Because both exams obviously are standardized tests, and these are metrics to evaluate an applicant in academic performance. So just to mention that under ACGME, they have made a statement that each exam alone qualifies for residency eligibility under the unification process. But obviously, we all know that this is pretty hard to enforce strictly at the ACGME level because really residency selection is at the PD level at the time of the selection process. And this is particularly important and pertinent for surgical specialties because I think that we're all creature of habits, and surgical specialties traditionally have been allopathic in training. And interpretation of a COMLEX score may be foreign to many of the program directors in allopathic programs. And just to add a wrinkle to this, one of our organization called COCA, this is the Commission on Osteopathic College Accreditation, mandates actually that the COMLEX, Part 1 and 2 of the COMLEX, not the USMLE, has to be passed in order for a DO candidate to finish medical school. And this is highlighted in red right there on the chart. So again, just to repeat, we do not have a choice. In order to graduate medical school, we must take Part 1 and 2 of the COMLEX and pass this exam. So ultimately, the dilemma is at the time of the residency application, and that is to say whether to duplicate the process in taking also the USMLE exam, because again, to repeat, residency, there are traditional allopathic, really they are more familiar with the USMLE exams. So in order to bridge the gap, our organization, which is the NBOME, this is the National Board of Osteopathic Medical Examiners, decided that they did a study on the concordance and relationship between COMLEX and USMLE score. This is comparable in my mind of comparing, say, SAT to ACT score in the pre-college examinations. So this was published in the Journal of Graduate Medical Education back in 2022. And what the study consisted of was they took more than 3,500 DO students across 5 colleges across the United States who electively chose to take both exams, which is step 1 and 2 of the USMLE, as well as level 1 and 2 of the COMLEX. And through data mining and interpretation, you can see on the right there's a conversion chart. So for instance, where the arrow is, somebody who scores between 460 to 479 on the COMLEX level 1 is equivalent to a 197 to 202 range in the USMLE step 1 exam. So basically, this is to make a more meaningful evaluation and comparison of the scores between the 2 exams. And just a quick mention of the pathway to become a plastic surgeon. Obviously, we all know this already, so I won't take a lot of time. This slide is somewhat outdated, but it still appears on the AAPS website. So we know that there's really 2 pathways currently. One is called the independent program, which a candidate must finish 5 years of general surgery before entering into 3 years of plastic surgery training. The other pathway is the integrated pathway where the candidate comes straight out of medical school for a total of 6 years, of which the first 3 is a combination of general surgery and some plastics, and then the last 3 years strictly in plastic surgery. There used to be a combined pathway, which is now defunct, so I won't spend time talking about that. So really, this is where the rubber meets the road. I've gathered some match data rolling back 3 years. This is for the integrated match, again, rolling back 3 years back to 2021. And I know this seems like an eye chart. So basically on the left-hand side, this is the block data from the NRMP website. And on the right is basically between the comparison between the DO and MD match rates. So you can see in 2023, there were 5 DO candidates that applied with 0 matching. 2022, there were 10 candidates and 0 match. A little bit better in 2021, where there were 20 candidates and 2 match. So this equates to an aggregate 6% total match rolling back 3 years of osteopathic candidates into plastic surgery program, compared to a 69% acceptance rate in the MD world. So this in comparison to independent programs, which is through the San Francisco match, again, rolling back 3 years. I won't go through all the math again, but you can see that for the past 3 years, the aggregate match rate for DOs is 50% versus a 62% in the MD world. This is obviously more equitable, and I surmise the difference being that selection of a DO candidate into the independent track maybe is a softer conversation, since that applicant at the time of application is involved in an ACGME approved general surgery program already. So he or she may not be as much of a foreign concept to program directors in plastic surgery. Moving forward, some of the challenges and barriers as I see it is, number one, I think that there's still an inherent bias historically because of lack of familiarity of the whole osteopathic profession. For instance, for medical schools, there are currently 155 allopathic medical schools in the United States versus only 38 osteopathic medical schools. For board-certified plastic surgeons, as of 2022, there are greater than 9,500 MD plastic surgeons in the United States versus less than 150 of us. For licensing board exam, there are two entities, the COMLEX versus the USMLE, as I mentioned before. And this is particularly pertinent in my mind when you're applying either in an integrated versus an independent program. Number two, research opportunities for osteopathic medical students. So I think that traditionally, the research track has not been the highest priority in osteopathic medical school, but the landscape is changing under the unification process. And I know for a fact that in my base institution, which is PCOM in Philadelphia, they have allocated much more resources, and they have now an independent research wing to help the medical students in the research arena. And finally, basically the goal of all this is to bridge the gap between our two disciplines and to create a more homogeneous mix of DO and MD plastic surgeons moving forward into the future. So this concludes my presentation, and I hope I have clarified some things between our two disciplines, and I'm sure I've generated a whole lot of other questions. This is my contact information you see on the right. Please do not hesitate to contact me via email or my cell. I'd be happy to answer any questions that you may have on this topic. Thank you very much.